Welcome, everyone, to Urban Healers Podcast. I am your host, Stephanie Naylor Lillard, and a mental health therapist associate at Urban Healing Counseling. Urban Healers Podcast and Urban Healing Counseling was founded by our CEO, Janaea Sattler, who cultivates an environment where asking for help is our greatest strength. Today, our podcast will focus on rewiring the soul, integrating biblical principles with cognitive behavior therapy. And today I am excited and delighted to introduce our guest, Benita Drayton, who is a licensed clinical mental health counselor and one of our amazing therapists at Urban Healing Counseling. Welcome, Benita, to Urban Healers Podcast.
Thank you. I am truly glad to be here today.
We are glad to have you here. And I tell you what, audience, this is a treat today because she is going to talk about integrating biblical principles with cognitive behavior therapy. And before we get started, Benita, can you tell our audience a little bit about your background and how that background influenced you connecting biblical principles with the evidence based intervention of cognitive behavior therapy?
Yes, my background consists of many different avenues. I did not initially seek to be a therapist in my career. I actually delved a little into insurance and then went back to school to become a speech language pathologist, which at that time didn't really pan out because I was with a non-traditional student. So I was already married with children. I decided to go to the Department of Social Services and work in the Economic Services Division, where I was what they would call someone who evaluated you for services. So I did that for a while, and something just kept, you know, pricking me about being a counselor. And even after I received my bachelor's when I was in my 30s, I kept wanting to learn more about counseling. Not really understanding what counseling was at the time, but something just kept pricking at me about it. Well, just to tell you a little bit about my background as a Christian, I actually became a Christian at the age of 21. And I have been through many different challenges in my life, in relationships, in family, just different things that really challenged not only myself, but my beliefs, what my values were as a person. And my life pretty much is the reason I feel God has led me to counseling. And when I actually decided to return to school to get my master's in counseling, it was when I started learning more about counseling, I realized that I had been counseling all my life. I started in middle school counseling, didn't know that's what I was doing because everyone always came to me to listen. I was always the one that had that listening ear. And everyone would always tell me about their problems. And the funny thing is that I never felt the need to share what was being shared to me with other people. Didn't know that that was a quality and a gift that God had given me. Because usually when you're kids, you take information from someone and you want to tell someone else about it. But that's not something I ever desired to do. I recognize that as a gift. So as I continued my journey and realized that counseling was my gift, I went back to school, received my master's, and here I am. And when I first started, I began working with children and their families. And I think I needed that to understand the relationship between parents and children so that when I did counsel adults or moved on into counseling adults, it gave me a better understanding of you know, that childhood trauma really affects you in your adulthood. And because I was a Christian and I was able to, you know, recognize certain things about human behavior, right? Through cognitive behavioral therapy, I recognized that a lot of the things that were stated and some of the techniques in cognitive behavioral therapy, they're biblical. And we don't realize that, you know? So the more I studied and delved into it and begin to recognize that they have a lot of commonalities, scripture and cognitive behavioral therapy. And I just saw where it just really related a lot. And as I began to counsel my clients, I just saw the effect that it was having on them to show them this. And it's like, you know how you have the light bulb moment when things
Yeah.
clicking in your head and you begin to understand why? I think that began to transform in my clients. And that allowed them to grow and to understand themselves better as human beings, as individuals, having individual rights. And I tell you, some of the work has been very transformative.
Well, I mean, audience, I told you you were in for a treat today. You see that, Benita, as she called herself a non-traditional student, we're going to say she had a lot of life experiences going into those classrooms. And sometimes when you have life experience versus the theoretical modalities that you learned in school, um, sometimes they sort of are parallel, and at other times they are perpendicular, and sometimes you're saying, well, wait, but real life says XYZ. How do we bring this in? And
Mhm,
with cognitive behavioral therapy, being a structured goal oriented
mhm,
form
mhm,
of psychotherapy,
mhm.
it talks about sort of modifying some of those thoughts, those rigid thoughts, right? And so, Benita, can you sort of walk us through a common scenario that you see in your clients where their negative thought patterns have sort of driven their current outcomes before they sit with you, Miss Benita, and you teach them how to address those things using cognitive behavioral therapy?
Absolutely, absolutely. First thing is that I start with their childhood life, like
Okay.
some of the childhood experiences that they had, such as trauma or having their voice taken away from them as a child, not being able to be creative, or just their own family's values and beliefs that were driven into them, not their own values that they created, but their family's values and beliefs. That's what affects how you think. Okay. They have this thing called automatic negative thoughts. I noticed that when my clients use those a lot, and you can recognize people who use a lot of automatic negative thoughts by their narrative. Do they talk negative all the time? Are they gossipers? Are they people that never see the good in anything? And if I recognize that in my clients, then I start showing them the difference between a negative narrative versus a neutral narrative versus a positive narrative, and how
Mhm.
it affects the way they think. In scripture, it tells us to renew your mind daily. And that's really what these thoughts that we have. If you're renewing your mind daily, that means you are incorporating positive thoughts in your way of thinking. Okay. Because when you renew your mind, you're renewing good things, because that is all that God offers to us are good things, right? Not negative
Mhm.
things. Right.
Mhm. Mhm.
And so I help them to recognize how they think. What are some of these negative thoughts, these automatic negative thoughts? Are you a gossiper? Do you talk about people? Is that even appropriate? Because the Bible tells us that we should not be gossipers. Okay. We should not be backbiters because these are things that can tear away at your soul, you know, at your spirit, the things that keep you connected to your believer. So I start with that. And once I get them to start recognizing those things, I give them homework. Okay, put on your phone notes whenever you have a negative thought pop in your head. Okay. And all the thing I ask them to do is first recognize that you're doing this. Because some people believe that you can't control your thoughts. Because that's the first question I ask them. Do you believe you can control your thoughts? And most people say no. They just go about their day thinking, you know. But when I show them how their parents have formed their narratives, right? Then they begin to see that these are some of the things that they have incorporated into their own narrative that's not producing good fruit. In the word again, it says, there is life and death in the power of the tongue. So the things that you say, the things that you think, they affect you emotionally and your behaviors, you know, it affects you. So once they begin to recognize that they do have these negative thoughts, then I start teaching them how to reframe those thoughts. And that's one of another technique of cognitive behavioral therapy. So whenever they have these negative thoughts, I teach them how to reframe them. And sometimes they don't know how to reframe them because they've never done this before. So I have to provide examples from them in their everyday language. So I have to um, create frames based on how they talk. Every person culture is different. I recognized that early when I worked with children. You can have 4 Black families, right? Every one of those families' culture and dynamics were different. Because you hear people saying, oh, all Black people this or all white people that. No, that is not true. And that's something that I am trying to teach people, that you have to disband those thoughts because those thoughts are not true. We are all different. Every family is different. Okay. So they recognize them, they start reframing those thoughts, right? And then I start teaching them about boundaries. Boundaries, all of this really encompasses in one big circle. Because once you start learning techniques in cognitive behavioral therapy, and of course, boundaries is another one, then you can start setting boundaries around what you will allow your ears to hear, your mind to think, and your mouth to say. And once you get in that space and you start seeing these things, then you can start setting boundaries, healthy boundaries for yourself. What you will not allow yourself to say in how you communicate with others, right? With using assertive communication, being true to yourself. A lot of people don't realize that when you set healthy boundaries, they think that you're being mean, or that you're not being nice. But, God told us that we're to protect our own hearts and our own minds. And if we're not doing that, we're not being true to Him or to ourselves. And once I teach them how to say no, at first it feels like they're committing a sin. They feel guilty. I just don't want them to feel like that I'm hurting them, or I don't want them to think this of me. And I tell them, why are you concerned about what others think of you? Are you not concerned about what you think of yourself first? because that's what's most important. Are you being true to yourself?
Wow, that is pretty powerful. I mean, audience, did you hear Benita? She talked about negative thoughts, about reframing, about setting boundaries, and all while using biblical principles to do it. You know, Benita, as you're sitting here talking, I was thinking about one of the examples you used, which was like an overgeneralization example when you say all people do this or all people do that, or
Mhm,
this is always this way. I didn't get the job because I'm never going to get hired. Those overgeneralizations,
mhm,
and you said something critical, audience, and she talked about how sometimes we build these narratives based on our home environment, based on what our social construct is, whether that's grandparents, parents, caregivers, an extended community that uses overgeneralizations to
mhm,
communicate thoughts. And what Miss Benita is saying is, well, let's talk about that. Maybe let's reframe that. Let's also use a different language because the power of life and death, she talked about lies in what we say.
mhm.
So we have to get real specific about the things that we are communicating because the universe is listening, according to what Benita is saying. So, Benita, could you give us an example of how we could refrain from some of the everyday language that we use? For example, I broke my diet, so I might not as well eat anything, or I broke my diet and I'm going to eat everything in sight. Walk us through how we can reframe that statement and those thought processes.
Absolutely. There are several what they call cognitive distortions that we use, and that's just one of them that you talked about, overgeneralization. Also, catastrophizing is another common one that we,
Oh, yes, yes, yes.
yes, that catastrophizing is so common, and we don't even realize we're saying these things because that's the narrative that we're used to, right?
Right.
And we need to just stop and think, really ask ourselves questions about our thoughts. Is it really true? Does everybody do this? All people, even I have to stop myself at times. And one thing I like about learning these things and learning about cognitive distortions and learning about your narrative, it is a lifelong construct. You will be learning something new about yourself as you continue to mature. Not get old, but to mature. Okay. When we say these things, it eats away at our inner self. Think about the word that we say constantly. I'm sorry. Oh, I'm sorry. Can I do this? Oh, I'm sorry. I didn't mean to do that. That is a reflex that we use that has been passed down from our parents, our grandparents. It's just a construct that we have used over and over and over, not realizing that it is something that diminishes us in a way. It's sort of like we're dumbing ourselves down to make whoever we're communicating with feel more important.
Wow.
Okay. So we have to be mindful of these different constructs that we use in our thinking and in our speech. Okay. A lot of the things that we say, especially these distortions we have, there are so many of them. And I encourage anyone who's listening to Google cognitive distortion and read about them and see if you do any of these. More than likely, you have done at least one of them, or you do all of them.
I was just thinking about that. Catastrophizing thought would be, if I fail this quiz, I'll flunk out of college, and we deal with an array of
Completely.
college clients. So
Yes.
that is what we hear frequently, catastrophizing audience.
Yes. Yes, mind reading is another one. I think that was one of my favorite people predicting what is going to happen to you. A lot of people like to do crazy things for like 30th, 40th birthdays, right? So what brings to mind when I hear about that is when someone say they want to jump out of an airplane on a parachute, do a parachute flight. And I've heard
Mhm.
people say, girl, you're gonna kill yourself doing something like that. How do you know that? It's like you're predicting these things to happen, and you don't know that this is going to happen. And I encourage people, you can't know what other people are thinking. So don't try. And if you're really curious about what's going on in somebody else's mind, ask them. That's the simplest thing to do. Don't assume, ask. And that's the hardest thing for us to do, you know?
Yeah. Yes, I mean, the chat is sort of going. A lot of mind readers, in the chat. A lot of people say, yes, I catastrophize all the time and really wanting to understand what is the root cause of that. You named one main thing was, trauma and folks not realizing how
Yeah,
those events can affect their adult life
absolutely.
and their language and the way they communicate are in these sort of distortions, mind reading, catastrophizing, overgeneralization. These are examples we talked about today. So,
Yeah,
Benita, can you give our audience one technique that they could use to help with one of the distortions that we talked about today?
sure, sure. If you've never really recognized that you can control your thoughts, if that's something you've never believed, because some people don't believe that, I encourage you to start noticing what you think. Just start recognizing, because they're called automatic negative thoughts. And we don't even realize we have them. And I can tell you an example of what one of those look like. I'd be riding down the street. Sometimes I might see somebody on the street that looks like a bum, You will have a thought pop into your head. Am I not correct?
That's true. That's true.
So that's an automatic negative thought because most time it's negative. Okay. So recognize that you do this. It could be anything. You could see some young kids, dancing and doing all kind of gyrating, especially if you're an older person. What is the first thought you're gonna have? They should be ashamed of themselves. And see, we don't realize that we get that from our parents. We heard our parents say these things. We did. We heard our grandparents say these things. Okay. And we just picked them up. Just was passed down. And I say this sometimes that a lot of the things that we get from our parents are from slavery. Sometimes, I mean, just think about it. Back in slavery times, you couldn't look at white people in the eyes. You always had to hold your head down, right? Anytime you addressed them, you had to say yes, sir, or no, sir, right? See, these are things we learned from other constructs in our life that has been passed down from generation to generation. Because I know my grandparents, if you didn't say yes, sir, or no, sir, oh, you was going to get a whoop.
Wow.
Well, why do we have to say yes, sir, and no, sir, when we can just answer yes or no?
Wow. These are certainly some paradigms and things to really think about. Is it generational? Is it passed down from multi generations? Right? Are there things that we constantly repeat with the people that we are around?
Mhm.
And so, Benita, I appreciate you sort of challenging our audience to make an observation of the things that they're saying and their thoughts and conversations. And this is so power packed, audience. We are going to have to do a part 2 of this particular topic because it has a lot of depth to it that needs additional explanation. I see the audience in the chat asking several questions. Yes, part 2. So we will bring Benita back, but we want to go ahead and thank you, Benita, for this amazing knowledge. And we look forward to doing this again. Audience, for more information about Benita Drayton, please go to www.urbanhealingcounseling.com. Please like, share, and subscribe this message. Thanks again, Benita.
You are so welcome. I appreciate everything.